Many men today are concerned about their testosterone levels. There's been a lot of publicity about and advertisements about what's called low T or low testosterone. There's all sorts of symptoms that are associated with having low testosterone levels in men. These include erectile dysfunction, depression, a gain of body fat, especially around the midsection area in the torso. Also, a loss of muscle or inability to build muscle if you engage in resistance training. You have to have a certain amount of testosterone to build muscle. And, so men are concerned testosterone levels do tend to decline as men age. Starting at age 30, testosterone levels drop 1 to 2% each year. Many men, by the time they're, let's say, 40, 50 or older, the testosterone levels can be very low, but it varies. This is something that's generally not publicized, but the extent of, let's say, testosterone deficiency or decline varies among individuals. Some men could reach 60 or even 70 years old and have fairly good testosterone levels where they don't need any type of testosterone replacement therapy. Another thing to consider is body composition, because having a high amount of body fat or having higher body fat levels interferes with testosterone synthesis and production, because it has to do with the fact that when you have a higher body fat level, there's an enzyme that's found particularly in peripheral body fat areas called aromatase that converts androgens like testosterone and DHA and others into estrogen. Now, the problem there is that the estrogen that's produced sends a feedback mechanism to the brain, to the hypothalamus, which secretes a substance called gonadotropin releasing hormone that controls the pituitary. I know, I'm sorry to get technical, but gonadotropin hormone releasing hormone from the hypothalamus travels to the anterior pituitary gland in the brain, where it promotes the release of another gonadotropin called luteinizing hormone. Luteinizing hormone then travels down in the blood to the testes, where it stimulates or controls or directs the synthesis of testosterone from a precursor of cholesterol. Now, I don't want to go off on a tangent, but I just, since I mentioned cholesterol, there's a lot of people that will tell you that cholesterol, being the raw material of testosterone, is important. In other words, you don't want to get your cholesterol too low, because then your testosterone levels are dropped. Other studies show that, and this has been shown, in older people who tend to have lower testosterone levels, they've done studies where they've given them either egg whites, which don't contain any cholesterol or fat, and whole eggs, which of course do contain fat and cholesterol. And they both engaged in a resistance training program. The older people that had consumed the whole eggs showed higher testosterone levels and greater muscle gains. So there is something to it. However, in more recent years, they've discovered that the testes can manufacture its own cholesterol. So you don't necessarily need to have cholesterol delivered to your testes in the blood. By the way, cholesterol is carried in the blood to your testes through a carrier called low-density lipoprotein, or LDL, which is considered the bad cholesterol because they have an association with cardiovascular disease. But it also delivers cholesterol to the testes, where the cholesterol is converted into testosterone. Now, what does body fat have to do with it? Well, when you have the body fat, as I said, when you have higher body fat, you have a greater activity of this aromatase enzyme, which is found in peripheral body fat areas like the arms and legs particularly. Aromatase, as soon as it encounters testosterone, it converts it into estrogen. Now, the problem there is the estrogen travels back to the brain, where it induces what they call a negative feedback signal, which causes the hypothalamus to stop releasing gonadotropin releasing hormone. So as a result, the body lowers its testosterone production, which explains why having higher body fat levels often lead to low testosterone levels. Now, the thing is, what they found is that, let's say a man has a higher body fat level. What I mean by higher body fat level, let's assume it's, normal body fat level in a man where you don't have any kind of hanging body fat, no so-called love handle, that kind of stuff, is about 15% body fat. At 15% body fat, a man is not ripped. You know, he might not even show abdominal definition, but he's not, doesn't have a lot of superficial fat. In other words, no hanging fat, no sagging pecs, no fat around the pecs where it looks like he has breasts. But the body fat, obesity starts to, in men, really starts at around maybe 20% and up. To be really obese, you have to be 30% fat or up. So if you have a body fat level of about, let's say, 20-25% and up, the odds are good that it's interfering with your testosterone production. So in that situation, before you have a testosterone test, and that's, like I said, I mentioned a couple of symptoms: depression, lack of sex drive or libido, low libido, erectile dysfunction, increased body fat, especially in the midsection, failure to make muscle gains, muscle loss. Those are some of the symptoms of a lack of testosterone. If you think you have that, and you're a man, especially a man over 40, it behooves you to go to a doctor and have your testosterone tested. Now, you should know, in the normal blood test that they give when you have a checkup, they don't test for testosterone. Most insurance, it's a separate test. Most insurance plans only cover basic lab blood tests. They don't they cover testosterone if the doctor requests it, but most doctors will not request the testosterone test unless you request it. So if you're a man and you suspect you have low testosterone through those symptoms I just mentioned, you should definitely have your testosterone checked. Now, there's a couple of nuances with that also. Before I get into that, if you take your testosterone test and you do have a lot of body fat, be objective. You don't have to look like a shredded competition bodybuilder. But if you have fat obliques and you have a little bit of a pot belly and all that stuff, you're probably carrying too much fat. And if you have a testosterone test and you show low testosterone, the first thing to do is to go on a diet. What type of diet you go into will be up to you. Again, individual tolerances vary. For diets, I personally prefer low carbohydrate diets. Low carbohydrate, moderate fat diets are always what work best for me. High carb diets do not work for me at all. I can't stay on them. I get ravenously hungry. I can't. But that's me. A lot of people, 25% of the population is not insulin insensitive. They can handle large amounts of carbohydrates. So for them, they can go on, let's say, a balanced diet that includes as much as 40-50% carbohydrate. As long as they lower their calories, they'll lose body fat. If you're insulin insensitive, in other words, you have trouble with carbohydrates, if you have elevated insulin levels, it's better to go on a lower carbohydrate diet. You get better results. So what you do there, if you take a testosterone blood test and you have higher body fat levels and you show low testosterone, go on a diet. If you're not working out, get involved in exercise. That includes both resistance training and aerobic exercise. Do aerobics at least 4 times a week, 30 minutes. Or you can do high-intensity interval aerobics, which involves shorter workouts, as short as 20 minutes, but it's much more intense. You have to bring your heart rate all the way up to about 90% for brief periods of time. That's high-intensity interval training. Either way, or you can do steady-state aerobics, which is just, keep getting your heart rate up to a certain point and staying there for about at least 30 minutes, and that will help you lose body fat in conjunction with a judicious diet. So what you do is you get your body fat down, then go have when your body fat is considerably lower, you can go by the mirror if you want, go by the scale, whatever. Best is go by the mirror. If you start, you see your body fat going down, then go back and have another testosterone test. The odds are about 80-90% that you'll now show normal testosterone levels. That's the first thing. Now, the other thing to consider about testosterone testing, lab testing, is the time that you take your test. This is an important consideration because testosterone is secreted diurnally. In other words, testosterone levels vary throughout the day in men. So, in other words, to make it clear, testosterone levels peak in men between the hours of 5:30 and 8 o'clock a.m., all the way up to about maybe 10 a.m. That's when testosterone levels peak. So if you want the most accurate testosterone test, when you go to have your testosterone tested in a lab, It's best to do it early in the morning. You'll get the most accurate. Now, why do I say that? Because there was a study published in the Journal of Clinical Endocrinology and Metabolism in December 2008 that looked at, wanted to test what happens when you have your testosterone tested in men at different times. So in this study, the blood samples were collected at 6 separate visits, 3 morning visits, 1 to 3 days apart, and 3 afternoon visits, 1 to 3 days apart. The study participants were 66 men, 30 to 80 years of age, randomly selected from the Boston area, who completed at least 5 visits. So now, what were the results? This is really interesting. In the men that were 30 to 40 years old, testosterone levels were 20 to 25% lower at 4 o'clock in the afternoon than they were at 8 o'clock in the afternoon. This is after the testosterone test. Let me repeat. In men 30 to 40 years of age, testosterone levels were 20 to 25% lower at 4 o'clock in the afternoon than they were at 8 o'clock in the morning. The difference declined with age. In older men, the testosterone level didn't decline that much. For example, in men that were 70 years old, there was only a 10% difference between the testosterone level at 8 o'clock in the morning and 4 o'clock in the afternoon. 17 men with at least 1 of 3 measurements less than 300 milligram. 300 nanogram is the minimum normal dose of testosterone. That's total testosterone, 300 total. Some people put it a little bit higher, but in most lab tests, 300 is considered the minimal level of normal testosterone. What was it? 17 men at least with 1 of 3 measurements less than 300 after 12 o'clock had normal testosterone levels at all 3 visits before 12 o'clock. 5 of 8 men 30 to 47 years old, 4 of 9 men 66 to 80 years old. Much lower diurnal variation were found for dihydrotestosterone, sex hormone binding globulin, luteinizing hormone, follicle stimulating hormone, estradiol. In other words, what they're saying here is that the variation in hormone levels didn't apply to other hormones like dihydrotestosterone, which is a byproduct of testosterone metabolism. The levels didn't change much depending on time. Sex hormone binding globulin is a protein produced in the liver that binds with testosterone. I believe there's, if I remember correctly, there's about 6 of them. It's been a while since I looked at it. But the sex hormone binding binds with testosterone in the blood, and it prevents it from being prematurely broken down. But an important point about this is that sex hormone binding globulin, when testosterone is complexed or bound to sex hormone binding globulin, it's not active. In other words, it cannot interact with androgen receptors. Therefore, it exerts no biological activity. Only the free or unbound form of testosterone can interact with androgen receptors and exert anabolic and androgenic activity. Now, testosterone is also carried in the blood by another protein called albumin. Now, when it's bonded to albumin, it's bonded much more loosely compared to the way it's bonded to sex hormone binding globulin. So with albumin, it can actually break off and still become free testosterone. Now, here's an important point. When you have the usual testosterone test, the result you get in almost 99.9% of cases will be for the total testosterone level. The total testosterone level includes both bound and free testosterone. It's not an accurate assessment of your testosterone. In other words, a lot of that total testosterone is bound to sex hormone binding globulin, or SHBG, so it's not active. To really know what your true testosterone level is that you have to know your free testosterone level. The free is only about 1 to 2% of testosterone in the blood is free, and this is the testosterone that can interact with androgen receptors and exert anabolic and androgenic effects. So the conclusion here is that I think this is very important information for men that are concerned about their testosterone levels, because the take-home messages are first. If you want to have your testosterone level, the most accurate measurement will be done early in the morning. The 8 o'clock would be best. Between 8 and 9 would be best. No later than 10 in the morning. As the day goes on, your testosterone tests will be less accurate. If you have it done, let's say in the middle of the afternoon, about 4 o'clock, it could be as much as 25% lower than it actually is. So keep that in mind. It may be tough to get up early in the morning, but at least you'll get it. And also, I mentioned this in a video I did with Rick Drayson many years ago. Well, not many years ago, about 10 years ago, something like that. With my good friend Rick Drayson, we were talking about testosterone therapy, and I mentioned a study that I saw where a doctor, his opinion, I don't think this was his opinion. This is a guy who worked with a lot of athletes, this physician. He felt that if you are going to inject testosterone for anabolic purposes rather than testosterone replacement therapy, you'd get less side effects if you injected it, again, between 8 and 10 a.m., because that's when testosterone normally peaks in the body. That's when your body produces the greatest amount of testosterone. And if you inject the testosterone between those hours, your body will, it's kind of like a Trojan horse effect. Your body will think it's the normal testosterone release, and it will cause less suppression of, let's say, you're in the hypothalamus and all that stuff. So the bottom line is you'll get less side effects. That's what this doctor said. So I just wanted to pass that on because it might actually work. It makes sense physiologically. So that's about it for this topic. And I also want to just say one more thing about the testosterone replacement therapy. If you're really truly lacking in testosterone, what I mean, and to know that your testosterone has to be less than 300 nanograms per deciliter. In other words, if it's something like 200, 100, it depends whether you or not you need testosterone replacement therapy. It depends. In other words, if you're feeling okay and you don't have any of the symptoms I mentioned earlier, such as inability to build muscle, gaining body fat, depression, all that stuff, if you're not feeling any of that, I wouldn't jump right on testosterone until you really need it. Because you have to understand, testosterone is not, we're not taking it, testosterone replacement therapy is not like the bodybuilders where they cycle anabolic steroids, they go on and off. Testosterone therapy is meant to be taken for life. It's not something you go on and off. So you don't want to get on testosterone replacement therapy until you really need it, right? And again, it depends. If you are experiencing these symptoms, it might be a good idea to try a testosterone replacement therapy program. If you go to most physicians, they'll put you on a kind of a patch or a dermal or a kind of an ointment form of testosterone. Topical is what I meant to say. Topical testosterone. They almost never give testosterone, or they never prescribe testosterone injections because of the notion that testosterone injections, they tend to cause a super physiological rise in testosterone for the first 48 hours and then followed by a gradual decline in testosterone levels. And they feel that this is not physiological. They don't like the fact that the testosterone levels get very high for the first 2 days and then gradually decline over a period of about 2 weeks. However, the testosterone level never really drops back down to baseline until after about 2 weeks. It doesn't really you're not going to be like deficient in testosterone. However, it's also important to note that men who undergo testosterone replacement therapy, who are interested in building more muscle, even if you're, let's 40, 50 years old or whatever, you're going to get much better results with testosterone injections than you will ever get from taking topical versions of testosterone. The reason for that is the topical versions of testosterone, they are designed to ameliorate a testosterone deficiency. What that means is they'll bring a lagging testosterone level, let's say at 300, let's say 200, which is a testosterone deficient level. They'll bring it up to about 500, which is the midpoint, because the testosterone scale goes from 300 to about 1,000 or 1,100. So by bringing it up to 500, you're right at the midpoint of the scale, and physicians believe that's the most stable level of testosterone, least likely to cause any side effects related to testosterone replacement therapy. Now, some guys can build muscle even on 500 nanogram measurement of testosterone, but my research over the years tells me, and I came across a couple of studies, that to build muscle you need at least 800 nanograms per deciliter, and to get that, again, some men taking the topical versions of testosterone will be able to get to 800. Most will not. Most will get to about 400 to 500. So if you're interested in building muscle, you might try and get on a injected form of testosterone replacement therapy, because it does raise your testosterone levels much higher, and it's not dangerous if you're careful, if you don't overdo it. You don't take more than 100, 200 milligrams a week at tops. You don't take any more than that, and you should be fine. Again, this is specific for men that want to go beyond just testosterone replacement, and they want to build a little extra muscle, especially if they started out testosterone deficient. So I think that's about all I have to say about this. I cover a lot of these topics in my Applied Metabolics publication. I cover a ton of research about testosterone therapy, new information about it, and new ways to do it, better ways to do it, ways to avoid testosterone deficiency, and so on and so forth. I also cover nutrition, exercise science, anti-aging research, ergogenic aids, hormone therapy, including testosterone replacement therapy, DHA therapy, all that kind of stuff, and supplement science, which supplements work, which ones don't, women's health and fitness. All of this is covered in my Applied Metabolics. It's at www.appliedmetabolics.com. 30 to 40 pages, no ads, no bullshit. I'm just giving you pure evidence-based information that includes my over 62 years of constant study and experience, which I don't believe can be matched by anybody. I've learned things over the years. This might sound like a little bit of hubris or bluster. I apologize in advance. But I've learned things over the years, over the many, many years I've been involved in this stuff, again, over 6 decades, that you just can't learn in school. I don't care how many PhDs or MDs a guy has after, or a woman has after their name. I've learned things that they will never learn. And I impart this stuff in Applied Metabolics. If you read Applied Metabolics, you'll avoid a lot of the mistakes I made when I was in competitive bodybuilding, and I did make a lot of mistakes. And I will tell you, based on science and personal experience of myself and countless others, because I've interviewed literally thousands of bodybuilders over the years, and I know all the tricks and all the stuff that works. It's all in Applied Metabolics. So subscribe today. When you subscribe, send me a email, and I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information right off the press on nutrition, exercise, and general health. I have an email portal on my Applied Metabolics webpage where, did I say, I meant Facebook page where I post new information. I do have a email portal on my Applied Metabolics webpage where each day, where current subscribers only can send me short questions about anything they read in Applied Metabolics or anything they're curious about related to nutrition, exercise, and I will answer the question in appreciation of their subscription. That applies only to current subscribers. And also, if you think my channel here is of use, again, no frills. It's just pure evidence-based information, practical information. No dancing girls, no smiling cats, no cartoons, just solid information. Please feel free to subscribe to this channel. It's completely free. I post a new video every Tuesday. And please tell others about my channel. I'm trying to get it to grow. There's a lot of information that's good on YouTube. But I would tell you, having seen a lot of YouTube videos, in my personal opinion, about 98% of it is trash. It's misinformation, and it's garbage. And a lot of it is, as you know, anyone could see, heavily commercially biased. In other words, these people are trying to push products, and they will bend the truth to try and sell their products. I don't do any of that, either in Applied Metabolics or in my videos. So if you want to have other than that, if you want to have the best friend you'll ever have, please go to your local shelter, adopt a dog. And just today alone, just to keep you guys appraised of my progress in trying to get another dog. My best friend Bruno died 2 years ago. I'm trying to, I want to get another dog. I put in an application today to get a little dog with one eye. He has only one eye. It's a little poodle. I thought he was very cute. His name is Winky. So I put in an application today. I just put in only about 2 hours ago. So I haven't heard back. We'll see what happens. But, maybe if I get Winky, I'll bring him into one of my videos. Thank you for listening.